Hello, hello, and welcome to this week's episode of Ask Dr. Jessica. I am the most excited today because we have on the episode one of my favorite human beings of all time, Dr. Jocelyn Chapman. Hi, Dr. Jocelyn Chapman.
Hello, Dr. Jessica Hochman.
Uh, Jocelyn has been my dear friend, one of my dearest friends since medical school. And I'm having her on today because I think she's probably the best person I know who can gracefully balance having a career and being a wonderful parent. And so I wanted to have you on because so many of us out there, we want to be the best at our career. We want to be the best at being a parent. And it's really hard to do both. And I have to be honest, I have learned so much from Jocelyn over the years. She's my inspiration at doing both well. And I thought that some of my listeners might also benefit, if you're out there trying to figure out how to navigate both waters. I thought hearing your words of wisdom might be helpful. So first I wanted to just talk about who you are and what you do for a living. I think you are so interesting because, Jocelyn is a cancer surgeon for women who get cancer in their reproductive organs. So
right.
she has yes. So I don't know how you do it and then come home and be a great mom, the great mom that you are and wife. But I thought, let's start from the beginning because I think your history is so interesting. Before medical school, tell us about what you did.
Yeah, so before I met you, I had a former life as a classical pianist. That's what I went to college for, and honestly, what I thought I was going to do with my life. Um, and the transition is never as sort of earth-shattering, quick as it seems, later on. When it feels like this real 180-degree turn in the road. At the time, it was more like I realized that being a professional musician is a really hard road. Actually, you never know where your next paycheck is coming from. It can be a very uncertain life. And while I very much enjoy the discipline of music and practicing and all of those things, actually making your money doing that is really it's actually kind of different thing entirely. And that piece of it I really did not fit well with my personality. So little by little I tested the waters to think about what else I might do. And I went to Columbia and did my post-bac because I had taken none of the correct classes to get into medical school as an undergrad, and I gave myself permission, even with that change, to say if I don't like this, I can always go back to music. There was kind of always with the idea looking over my shoulder that music was going to always be something that I could do if the next steps I was taking towards medicine didn't work out or didn't feel right. But yeah, every step along the way, I really, fell in love with medicine, and it felt like the place where I wanted to make my career. So, in Boston Medical Center for medical school is where I met you. And I did go to medical school thinking I would be a surgeon, mostly probably because of my experience with music and piano in particular. It's a very tactile job, and I enjoy obviously solving problems with my hands and working that way. So yeah, so I thought I would go and do surgery, but what I really discovered in medical school actually is um, there was in surgery anyways, the part was missing was like longer term relationships with patients, and so in obstetrics and gynecology, there was this cool surgical specialty called GYN oncology, or gynecologic oncology, as you called it, as you said. And I really fell in love with it. I think there was a big piece of it too about the women's health, and women are actually like the center of our communities. They help keep the world spinning around. And so, it's if a woman is diagnosed with a cancer at the age of 50 or 60, like that's very impactful for her family. So it seemed like very important work. And yeah, so went to residency and fellowship and now practice at UCSF, and I love my job. Yeah.
Thank God you're out there. Just out of curiosity, when you made the decision to be a surgeon, did you always know you also wanted to be a mom? Like, did you ever worry that that would get in the way of being a mother? Because I think about this because so many females that I meet in medical school, we gravitated towards jobs with more flexibility. You know, when you're in a
Mhm.
surgery, you cannot be reached the whole time you're in the operating
Yeah.
room. The hours are a lot more intense. The day is much more intense. I'm just curious. Did that ever worry you, or did you know that you were so excited to be a surgeon? Didn't you knew it would work out?
No, it's that's a great question, and it definitely crossed my mind. I think, the from the mom standpoint, I didn't get. I was already almost 30 when I was sorry, no, when I was getting ready to graduate from medical school. I was just going to turn 31. So I had like met and married my husband in right around the time when I was starting medical school. And we got married about halfway through. And up until that point, I hadn't actually been convinced that I definitely wanted kids. Um, and I actually think, if anything, it was music, the my career in music, that made me worried that that was not compatible with having a family. Um, Kind of for some of the reasons that you talked about, that like the hours are not, there is some flexibility in terms of like practicing the piano, but like if you're on the road doing gigs, like you're away a lot, that there's, that just didn't, I didn't know many musicians who had not any female physicians anyways who had families. And then when I went to Boston Medical Center, though, my very first like research mentor was a pediatric surgeon who was at Harvard Medical School. And I'm not even 1,000% sure how I got connected to her, but at any rate, her name is Catherine Chen, and she had three kids, and her husband, I think, was an anesthesiologist, but he was not practicing. He did like more, I think he was a consultant. At any rate, he was the flexible one, and she was the non-flexible one. And honestly, they made it work. Her kids loved her. And so in some ways, I should probably send Dr. Chen a note and tell her how I think, actually, because that was my first sort of mentor relationship in medicine, really right as I was getting started in medical school. I don't think that I worried that much about being able to make that work, as long as you had a good partner, who was, able to kind of help pull their weight. So yeah, I need to go back and thank Dr. Catherine Chen, because she was, clearly, now that you've asked me this question, I reflect on that being kind of impactful.
I can see that. Like, you have a mentor who's doing it, and then you see, oh, this can be done.
Right. And then it just doesn't occur to you to worry about the alternatives, right? Because you kind of already have an example of somebody has figured this out.
What I think is interesting that you said, I wouldn't have thought that being a pianist would have been a more difficult lifestyle to lead as a mother than being a surgeon. But the points you make are really good. I mean, you're right. You probably have to, I imagine, tour a lot, or you're not sure where you're going to be playing professionally. So you have more stability as a surgeon.
Right. I mean, there's different ways to be a musician, but yes, I went into medicine for a more stable life, for sure. Classical piano in particular, because it's just you're a soloist. So that means that nobody is really paying your salary. And your life is kind of like more like an actor's. You have an agent, they book you gigs, you show up at the gigs and you play, and in ideal circumstances, like that's how you make your money. A lot of musicians, of course, do additional things like teach piano, and sometimes if they're not as successful at the performing, they become a piano teacher. So, there are obviously all sorts of variation in how people make their life as a musician, but in general, it's a pretty uncertain lifestyle, especially for the soloist. The ideal scenario for, or the most stable job is the one that somebody can get with like the symphony orchestra.
It's really interesting. Wow. Well,
Yeah.
I'm selfishly glad you made the decision to go to medical school because
We wouldn't have
I
met.
I don't know what I would have done without you, to be honest. But
I feel the
um,
same way.
uh, no, it's
Yeah.
true. I mean, I tell this story a lot, but when Joss and I used to study together, she was my source of focus. So I tended. I hope I've matured since then, but I tended to look for breaks often, and my breaks would be. I would like to go to Dunkin' Donuts in Boston was a big
Yeah.
chain, and I liked the candy store around the corner. And thank goodness for Jocelyn, she influenced me instead to take walks together during our break. So she was a really good influence for me in many ways. But so again, that's also why I'm so excited to hear you guys uh, learn from Jocelyn as well, because they say you become who your friends are, and I definitely think you've influenced me in so
Oh,
many positive ways. I
well,
probably
I
have
feel the same.
many fewer cavities because of you, and
I
and
feel the same way.
and better cardiovascular shape. Um, okay, so you talked about how you went to medical school, or you finished at 31. When did you finish your surgical training? How old were you when you were done with everything?
36.
And
Yeah, I was 36.
and then how did you fit in having children? Did you wait till you were done
Well,
with your training?
built into the fellowship was a research year. So my initial grand plan was to have my first baby during the research year, and then I would be pregnant, but not delivering a second baby until I was done with my fellowship. And then I would be kind of safely in this healthy reproductive age. I mean, I had done a residency in obstetrics and gynecology, so I know the data well that after the age of 35 or so, your fertility kind of plummets. And that's the average age. And so for any individual, it could be earlier or it could be later. But I was kind of working with those numbers, but then we had a lot of trouble getting pregnant. And I went very quickly to the infertility doctor and actually froze my eggs. Froze embryos. And I think that first egg freezing was done at the age of 34. Um, and then we actually did a second round a couple of years later when we were still also having trouble getting pregnant. So it was a really, really big, long process, and I'm sure it was exacerbated by the 80-hour work weeks and the lack of sleep and, all of the stress of the training itself. It's very hard to put medical objective data on that, from the blood tests and the things that were being evaluated. Things should have been fine, and for whatever reasons, they were not really fine. So, yeah, so that was so I didn't end up having my first child until 2016, and I was 38, I guess. Yeah, 37 or 38. And she was the product of IVF and very healthy kid, but she was from 34-year-old eggs actually. Um, so it's Medicine is very fascinating, and biology is some of the technology that we can have 34-year-old eggs kind of frozen in time. They're healthier, and then transplanted into our body 4 years later. It's kind of a miracle that happens, but yeah.
And I think I mean, knowing your children now and how healthy and gorgeous they are, um, it's interesting because those years were so stressful.
Yeah.
But thank God you
Oh
pushed
God.
through it.
Yeah. We really, I mean, my husband Mike, he's been my partner in crime for, well, we've been married for almost almost 14 years, and then I've known him a lot longer than that, and he's just a dear, and I really adore him. So, we had this idea. We really wanted to be parents. We wanted to have a family, and we probably would have adopted if it hadn't worked out for us to have biological children. But I'm I'm very glad that it did. I adore those kids. But I think for listeners out there who are professional women who are thinking about having kids, I think the other point you just said is it is this really small window of time in terms of our reproductive health, and it just unfortunately directly coincides with when we are also trying to get our careers off the ground and really prove ourselves and work hard, or get our medical training behind us, or whatever the situation might be. Those two things don't mix very well in my experience. So
Absolutely.
yeah, it's a
I think
very
that's the
big
harsh
problem.
reality, right?
Yeah, it's the harsh reality.
I think it's really helpful to hear that there's no way to do everything 100%.
No.
if you there really isn't. I think
Mm-mm.
you just I mean, the way I think about it is I just try to do the best that I can.
Yeah.
If
Well, and I think another framing sometimes is, and this is a little bit related to the timing thing that you said, is life is long. So, um, if having family or being home with kids or spending more time with young kids is important or necessary for your family to work, um, then that doesn't necessarily, I believe, anyways, that does not need to be the nail in the coffin of the career. Like there is time later to re-energize your career and spend more time and attention with that when the kids are less needy and when less time is needed at home. There's another
yeah,
piece of advice that I got from actually a woman who I kind of love talking to women physicians who are about 15, 20 years older than I am, because they were really like, in many cases, the first women in their graduate classes in medicine, and or especially like in surgical disciplines. Like it took longer for women um, to be in those specialties, and so they were, they weren't like the first women, but they were like one of that first generation. But there was like of a surgical class of 10, there might have been one woman. So they were very much like by themselves and kind of pioneers that way. Anyways, the advice
definitely.
she said to me was, um, she said, just keep your oar in, which she was specifically talking to me about research. And I think, worried that I wasn't going to be able to continue doing research because I just had too many other things. And she said, if you can just kind of keep your oar in, like really like bring your C game, bring your D game, like just like maybe show up for a meeting once in a while, but try to keep that going a little bit, then actually she found a lot of enjoyment and fulfillment from pursuing a lot more research later when her kids had graduated or were older. And because she had kind of still dabbled, still stayed like in that space, it wasn't like she quit and had to come back 15 years later. It was that she had literally brought her C game to the job for 15 years. And then at that time, when she could spend more time, she actually wasn't starting over, but I kind of, she felt that that was, a good strategy for her. I think about that a lot.
I think that's such good advice. Like as a mom or a parent who's listening or a dad who's listening, you can just if you keep your toe in the water and
Hmm.
keep your finger on the pulse. When your kids are older and they're busier and you have more free time, you can have an easier time building your career
Yes.
than if you just stop
Getting back
altogether.
into it. Correct.
That's good
Yeah.
advice. I like
Yeah.
that you said life is long because I'm always
Hmm.
saying life is short. Um, but you're right. I mean, when you think about it, the time with your kids being little is a finite time. And
And
you're
that
right. I
that part
think
is short.
that, so you might as well, if you can,
Hmm.
spend some time with your kids when they're young, knowing that you'll have time later
Hmm.
to build your career.
Yeah,
That's a good
exactly.
perspective.
Yeah.
Is now, are you able to do that with your career as a busy surgeon? Like, how do you, I mean, I'm asking because you're so good at balancing. I see you as a mother and you're so good with them and you're so focused with them, but you're also such a dedicated surgeon. How do you do it? Is it just, is it natural, or do you have, um, do you, like, what is your guiding principle?
Um, so, well, a couple things came to mind when you told me, you wanted to talk to me about this. I think one of the first things that I do is I'm really good with, and this is like modern medicine has actually enabled us to do this. There's 5 GYN oncologists. We have dedicated call weeks where we are responsible for the patients or the phone calls or whatever. On the weeks when I'm not on call, I see patients and I operate, but then nights and weekends, I am not working. And so I really try to actually create some pretty good boundaries around what is work time and what is not work time. And in some ways that training, I don't know how many of your listeners are physicians themselves, but in some ways some of that training actually started even in residency. Like I was not the resident who was looking at the ER list to see which patients may or may not get admitted to me, right? So there is a little bit of a like putting blinders on to say like if it's not something that I'm being asked to deal with, then I don't have to know about it. Um, and
Smart.
then when someone comes to me and asks me to deal with it, then I will deal with it then. But I don't need to prepare myself for a potential disaster or worry about who might come into the emergency room and need me or those sorts of things, because as we all know from experience, we can oftentimes expend a lot of mental or emotional energy on something that never happens. And that's obviously true in so many domains in our life. So I think I do really try to kind of separate that and emotionally detach myself a little bit from what's going on at work so that I'm not bringing that stuff home or worrying about what might come or who might call me or who those sorts of things. So I think some of that's probably a little part of my personality, and I also think some of it is just actually partly something that you can train yourself to do to kind
Intentional.
of yeah to be intentional about it exactly. Um,
I know that what you deal with at work can be very heavy. Do you find
mhm.
it really hard to come home and turn it off and play with your kids? I mean, how do you do that? Do you have any tips or tricks that
Yeah,
you
I've
use?
started. Yeah, there's I do think it's really it's such a good question because actually I think as physicians, it doesn't matter if we're dealing with life or death or something a little bit less serious. Our patients are coming to us, and oftentimes their problems are very important to them, and they become important to us, right? So there's a big emotional burden component to lots of places in medicine, and we all have to find ways to shed some of that burden that we take on so that it's not sitting heavy on our hearts while we're trying to laugh and play with our kids or pay attention to them. Um, so a little bit of emotional distance is necessary, and I think for me, anyways, one of the things that actually helps is a bit of distraction at the end of the day. I have this like, kind of 15-minute transition from leaving like the clinic or the OR and walking to my car, and I'll put my headphones on and listen to a podcast. I actually try not to something unrelated to medicine completely, and I intentionally try not to use that time to call a patient back or call a physician or something that might be on my to-do list that I've decided can wait till tomorrow. I try to let that really actually wait until tomorrow and not make use of every last single second. Because if I show up at my house and I'm just getting off the phone with a physician who's asking me about how to organize follow-up care for a patient who has cancer, then my brain is in that space. So I would say the intentional thing I do related to that is to actually just get my brain in a different space altogether. And podcasts actually really, really help me with that.
It's great. And
Or
and then
calling a friend. I call you sometimes.
I love it. I love when you do.
Yeah.
Makes my day. And then when you get home, are you intentional about how you spend time with the kids? Do you, how do you think about that, making sure that you have time for your children?
Yeah, I think the kids are now in school, so they're home by 5:30, and both Mike and I actually really try to put our phones down in a corner in the kitchen. So between, I mean, it's like an hour and a half really, from 5:30 to 7 or something, where we're getting the kids through dinner and baths and stories. That we're kind of divorced from the phone as much as we can be.
And I,
On a
I
week,
see. I see you do it, and it's very impressive because I think a lot of us are guilty of not putting our phones away, but you guys are very good about being present with your kids.
I really try to be. Mike is a little bit. He's a little bit more like you. Wants to have the phone nearby, mostly for the pictures or for the videos that can be funny and But I think the side effect of that can sometimes be that the text message comes in that you see, and then you
Right.
sort of get sucked into to doing that. So I mean, we all struggle with it, getting rid of the devices and actually just sitting down on the floor and being present with the kids. Trust me, I don't do it well every day, but yeah, that is something that I do really try to do.
No, when we spend time together, we vacation together. What I'm always impressed with is my kids. They're lucky if, you know, I make them breakfast, and your kids, their hair looks so good in beautiful, perfect braids. They're happy. They look, well put together. They've had good time with you. So I always look at you, and I'm just so impressed and so in awe that you can, do such good quality work as a physician and also be such a wonderful mother.
That's incredibly kind of you to say. Like I said, I don't think I've got it all figured out. Related to parenting, I do think, and I don't know how you feel, because on the spectrum of things, I think we people would say we in general had kids later than on the later side than on the earlier side. Me later than you, but in our 30s, right? We had kids,
Yes.
and I think I do think having one of the benefits of delaying your childbearing a little bit uh, is that when you do have your family, you are kind of really just ready to zero in on that as being like the most important thing, and the thing that you don't want to miss, because you've had time for the fun, cool vacations and the crazy trip to Las Vegas. And you also recognize that when the kids are gone, you're going to go back to those really fun, crazy trips. But
Because life is
but yeah,
long.
for me anyways, from my perspective, I think like I'm very content to spend this time with the kids, and I don't feel like I'm missing things. And that might be also part of the, like, when infertility is facing you and you're worried you might not be able to have kids, that you kind of realize like how precious that is,
You,
and how
you
lucky you
probably
are.
you appreciate it that much more.
Yeah, I do think so.
No, I can see
I
that
do
in
think
you.
so.
Um, no, this is really, really nice to hear because I do think, it, as I mentioned before, it's really hard to think that it's possible to quote unquote do it all.
Hmm.
So when I look at you, I definitely feel you are that person. So I appreciate hearing your perspective. And
That's very kind of you. I think I say this all the time. I think actually you said it to me recently, but one of the we have at UCSF, we have the Mariel Steele Society, which is a um, uh, founded by one of the first surgeons at UCSF. She's a female surgeon, and so it's a surgical society for women. And the medical students were a part of it were kind of interviewing and highlighting different women, and they asked me, what piece of advice I would give to, like, you know, surgeon moms, or I can't remember exactly the question, but I do think about this all the time, that it's not about balance. I think balance is the wrong way to look at this. It's really just about boundaries, and putting sort of boundaries around the things, doing the thing that you actually devoting your full attention to the thing that you are spending your time on in that moment. And then when it's time for that thing to be done, like actually devoting your full attention to the next thing. And for me, those two things are work and kids. And I mean, there are other things sprinkled in there, of course, but those are the primary things.
Absolutely. I like, there's a man named Jesse Itzler. He's
Hmm.
married to the creator of Spanx. I don't know if you've heard of him, but he has a line that I really like. He says, it's so important to be where your feet are.
Yeah.
You know, when he's with his kids, he is with his kids. When
Yeah.
he is at his work, he is at his work.
Yeah.
And I think
Yeah.
that's a really good way to think of things. And I think, you know, just piggybacking on what you were just saying.
Totally agree. Yeah. Be where your feet are. I like that one too. I'm going to take it now.
Well, this has been so lovely talking with you as always. Is there any other like last pieces of advice that you would offer to any parents listening out there that are thinking about this balance between, or trying to, as you said, it's not really a balance, but trying to do both,
Hmm.
have a well-adjusted family life as well as career?
Yeah. I mean, I think the last thing that comes to mind where, of course, I said, there are really two things of my focus. And Dr. Jessica has known this about me since we've met. And it's one of the reasons for sure that we are lifelong friends. But you have to have a community. You have to have a community of people who know you, love you, see you, and can kind of reflect back. The hard things, the good things, and Jessica's part of that community for me, and I actually do consider especially for me, my female community of friends to be these like crucial people that help hold your hand when things are hard and let you know you're okay. So, anyways, thank you for being that for me all these years. Yes.
Oh my goodness, it's an honor to say the least. It's immeasurable. So, anyways,
Yeah.
well, thank you. I don't want to get too mushy because I can. You know, I can.
Your listeners don't want
Um,
to hear that.
but I adore you. I love you, and thank you so much for coming on. And I hope anyone, you know, I hope people find you as inspiring as you are for me.
Thanks, Dr.
Okay.
Jessica.